Hello, how are you? Good.
Good, how are you?
Yes.
Am I coming in clear? Okay. Hello, everybody. I am Corey Haskett. I am with the Whitman-Walker Community Engagement Team, here to do a live for you all. Um, Paul, how do I pin what needs to be pinned at the
You
bottom?
just click on it and hold it down. Yes.
I have to type it in. Okay, 1 minute, guys. Let me type this. Bear with me, guys. I'm almost finished. All right, let's get started. Okay. During the past few months, Whitman-Walker Community Health Department has expanded its outreach efforts to social media platforms. We cover various topics about HIV/STI sexual health practices, access to care, social determinants of health, and public health interventions. The community health team is here to educate and support you. Hello, my name is Corey Haskett. I use he and pronouns, and today I will be discussing the origins around HIV, leading in leading in some facts and history around health disparities and activism around the virus. I will also be discussing advancements in treatment and holistic approaches to care. Um, the first pu- the first published report of what ulti- ultimately became known as HIV and AIDS appeared in the Centers of Disease Control, the CDC, in June 1981. When these initial cases emerged, very little was known about the disease. It did not have a agreed upon name. Researchers had not yet determined what caused it. There was no test or recognized treatments, and by the time most patients presented symptoms, they had only months to live. In the United States, where the disease was first seen in already marginalized communities, including men who have sex with men, MSMs, and people who injected drugs, and people who exchanged sex for money. The public and policymakers were slow to respond to this health threat. The history of the HIV epidemic highlights amazing specific discoveries and fierce advocacies in face of adversity. But it also shows stigma, discrimination, disparities based on race, sexual orientation, and socioeconomic status. There is a hope as scientific advancements have turned HIV from a death sentence to a manageable chronic condition, but there is still neither a cure nor a vaccine. So it's a little bit of about disparities in activism. HIV was first identified in MSMs, which served to increase discrimination. This this community was already facing. It quickly became clear, however, the emerging HIV epidemic was impacting the other communities as well. The first communities of HIV in women were identified in 1983. And in 1986, the CDC reported that AIDS was disproportionately impacting Black/African Americans and Hispanic and Latino Americans. Early in the epidemic, misinformation was abundant. The public the public worry they can get infected through casual contact like shaking hands, sharing a drink, or using public restrooms. In 1985, a young man named Ryan White became the face of AIDS discrimination while his school refused to let him in the building. White had hemophilia and contracted HIV from a blood transfusion, and the school feared that he would infect classmates. His court case battled against the district made national news and helped educate the public about HIV and, and the rapid spread. And it raised awareness of discrimination with people living with HIV every day. In the face of this stigma, many of the communities most impacted by HIV became fierce advocates of their needs. Founded out Founded out by the LGBT movement, the HIV community has history of activism that has shaped the course of the epidemic. In 1983, a group of activists met a gay and lesbian health conference, discussed the importance of self-determination and those who are impacted by HIV. The document they created became known as the Denver Principles. It rejected terms like AIDS victims and AIDS patients that implied defeat or helplessness and introduced the phrase people with AIDS. Through the 1980s and 1990s, groups like GMHC, ACT UP, the AIDS Coalition, MAC, the Latino Commission on AIDS, and the Black AIDS Institute formed to offer direct services, provide education, amplify the voices of marginalized community, and advocate for the laws and policies that can help those suffering the most. Thank y'all for coming in. I'm trying to read and interact at the same time. It's kind of hard. In 1982, the CDC has labeled the condition acquired immunodeficiency syndrome, and by 1984, researchers had identified the cause as a virus they called human immunodeficiency virus, or also known as HIV. Additional advances in knowledge included identifying how it spread and what to do to the immune system. By 1985, there was a test for HIV that could determine those who had the virus before they had symptoms. Treatment advancements came in 1987. The antiretroviral drug therapy, or AZT, called after a glimmer of hope. It was meant to prolong the lives of those living with the virus. However, it was found to prevent mother-to-child transmission if taken during pregnancy. New combination therapies were introduced in the early to mid 1900s that included two antiretroviral drugs. These were more effective at limiting the amount of virus in the body that often involve people taking more than 20 pills a day and dealing with numerous side effects. So now, holistic approaches. Many people living with HIV and AIDS use complementary therapies to help them manage their health. These methods don't replace standard medical care, but they may help you feel better. Here's a closer look at some common complementary treatments for HIV/AIDS and what scientific research reveals about them. Mind-body practices. Massage. Massage has a long-term history in Eastern and Western cultures and as a method of pain relief. There's not a lot of research specific to HIV and AIDS, but some small studies show that it may ease depression and anxiety. If it helps you relax and make you feel better, that's a benefit. Yoga. Research shows that yoga, which involves different postures, breathing routines, and meditation, may benefit people living with HIV and AIDS by lowering blood pressure, pain, and anxiety. Sticking with an ongoing practice would help you feel better. Meditation and mindfulness. Several research studies have looked at the benefits of meditation for a wide variety of health conditions. These practices focus on the link between the mind, body, and soul. The behavior to improve your health and well-being is always needed. When it comes to HIV and AIDS, scientists have found that meditation and other mindfulness training techniques like repeating mantras can lower stress and make you feel better and feel okay, and better be prepared to manage anger and conflict. Herbal dietary supplements, cannabis and cannabinoids. The FDA has approved that cannabis plants to treat any medical condition by the FDA has been approved. Certain prescriptions based on cannabinoids, a class of substance found in cannabis plant that includes THC and cannabinoid oil. So it's very basically smoking marijuana can help with the stress. One of these drugs are THC made Marinoid and syndromes. People living with HIV and AIDS and other conditions may use it to cure appetite loss or gain weight. There's not much solid scientific evidence to show that cannabis or cannabinoids work for the purpose and are safe to use. Studies to this date have been small and only lasted for short times. Even Evening Primrose Oil. This yellow flowering plant naturally grows in North or South America, but now can be found in Europe and other areas of Asia. Seeds from the evening primrose plant contain oil, which are loaded with omega-6 fatty acids. This oil may boost effects of the drugs lopinavir or retinavir used to treat HIV. Okay. Before we go, we want to give you a few reminders about COVID-19 and the vaccines. If you have already gotten vaccinated, congratulations. You have taken a really important step to preventing yourself and your loved ones and your communities from illness. The Delta variant is soaring across the United States at the moment, and it's totally understandable why you might want to keep wearing your mask. The vaccine isn't 100% effective. More contagious variants are spreading, and there are very few protocols in place to actually verify that folks around you are vaccinated. Keep on staying alert. If you have if you haven't been vaccinated and you're looking for an appointment, Whitman-Walker Health has COVID vaccine available for everyone 12 years and are eligible to receive a Pfizer COVID-19 vaccine. Please reach out to us at 202-207-2480 to make an appointment. If you are having trouble making an appointment with us, for DC residents, you can find information for COVID-19 walk-up locations and eligibility at vaccinedc.gov or by calling 1-855-363-0333. Track the speed of your COVID-19 vaccine lines by visiting coronavirus.dc.gov/don't wait. For Maryland residents, learn more about the Maryland vaccine distribution process and schedule a vaccination appointment on covidlink.maryland.gov or by calling 855-634-6829. If you live in the Prince George's County, visit their vaccine registration portal. If you live in Montgomery County, visit their vaccination registration portal or call 240-777-0311 to schedule an appointment. For Virginia residents, learn more about Virginia vaccine distribution process and schedule a vaccination appointment or at vaccinate.virginia.gov or by calling 877-829-4682. If you haven't been vaccinated and you're looking for an appointment, please continue to follow. If you haven't been vaccinated and you're not looking for an appointment, please continue to follow CDC's guidelines for mask wearing, quarantining, and social distancing. It is very important that you get back to the vaccine. Discuss COVID precautionary measures with those around you and be mindful of masks and keeping your distance, especially when you don't know whether a person has been vaccinated or not. Remember to follow us on IG or Facebook and Twitter at Whitman-Walker. And check, oh, how to discuss these. And checking out our website at www.whitman-walker.org for the most update information on our services and for COVID-19 resources and general Whitman-Walker services. Please call us at 202-797-4439. Follow some of our programs at WWH Family, at Real Talk DC, and at No Filter DC. Thank you all for tuning in. Much more to come. Many topics. If y'all want me to do any topics about anything, just you can DM them to me, and I will consider them creating a script. But signing out, it was a pleasure.